Hello from the UVA Mini-Med podcast. My name is Yusuf Ali, a fourth-year medical student at the University of Virginia School of Medicine. I'm here today to talk about how the coronavirus pandemic has affected medical education. The past few months have been a mix of surprises, challenges, and changes for me and my classmates. So to help us understand how the pandemic has affected medical students, we have a guest from the UVA School of Medicine, Dr. Megan Bray. Dr. Bray is an Associate Dean for Curriculum at the medical school, and she's also an Associate Professor of Obstetrics and Gynecology. Welcome, Dr. Bray. We're excited to have you here.
Thank you, Yusuf. It's very nice to be here.
Wonderful. So to kind of begin, I just wanted to set the stage for our listeners that might not be familiar with the structure of medical school. So the first 2 years of medical school kind of resemble the traditional classroom style course that you think of in high school or college. So you go to class, you take notes, you read your textbook chapters, you take exams, that sort of thing. So those sort of classwork style options tend to move themselves really well into an online setting. The third and fourth years of medical school are a little bit different in that students rotate through various specialties by working in the hospital and clinics. And these include fields like internal medicine, surgery, obstetrics and gynecology, pediatrics, those kinds of specialties that we think of. So that's also where students get their hands-on experience in the practice of medicine, and it's also how they decide what field of medicine they want to go into. So with that kind of background in mind, I wanted to ask you, Dr. Bray, can you talk a little bit about how the pandemic has affected third and fourth year medical student schedules with regards to their clinical rotations?
Yes. So when COVID really started to affect patient populations in hospitals, there was even a national concern about safety of non-staff learners, our medical students, our nursing students, et cetera. And there was a concern that on several aspects, would hospitals have enough PPE moving forward for not only frontline caregivers, but all of the additional staff and learners in the hospital. So that was a first concern. The second concern was the safety, obviously, of our learners, in particular our medical students, if they were going to come in contact with COVID patients, or even more concerning, patients that we didn't know were COVID positive prior to them becoming positive. And then lastly, there was really the additional concern that our medical student and nursing student populations, given their age bracket, which is in the mid-20s and 30s range usually, were felt to be an age population that could be asymptomatic carriers, and therefore would put our patients at risk. So really, for all three of those reasons, it got to be very concerning that keeping the students on the front line would put both themselves and our patients at risks. And nationally, many of our educational legislative bodies, that was really the reason. They were the ones that finally said, we need to remove students from the environment right now.
Wow. So that sounds like a very complicated situation, both for the students and, of course, the patients and other staff. And I can understand why they were pulled. One of the unexpected challenges I think it's led to is there are students like myself that might be between one or two or more medical specialties. And really, we depended on those rotations to kind of see and make that choice for ourselves where we wanted to go into. So something for us to kind of think about. And so as one of those students, I'm eager to know, are there any plans as to when we can return to our rotations?
Yeah, actually, the decision to return to rotations, again, was largely looked at nationally, as well as individual environments around medical schools themselves, and making sure that we had kind of flattened that curve enough to be able to safely reintroduce students into the clinical education environment. I think one of the things that I want to be clear about is that there is definitely a proportion of a medical education that has got to be completed in a clinical one-on-one patient environment. You can't do that virtually, and our accreditation bodies are very clear about that. So we were very cognizant of the fact that we needed to get students back into the clinical environment as soon as we could. So based upon numbers of COVID current cases within the environment, with ability to protect our patients, ability to protect students, we actually made a request of the provost of our university to ask, could we return our students now that we are in a safer timeframe into that clinical environment? Because unlike the undergraduate students who are, dealing with completely different circumstances, and those courses can continue virtually, the clinical education really needs to occur in person. So we made a request, and a part of that request was that we would be very mindful of social distancing when students came back, that we would be very mindful, or that we would have enough PPE to share with our students, that we would work to de-densify the number of students in all areas of the hospital. Our current staff and faculty have to daily make an attestation as far as are they feeling well? Do they have any signs or symptoms of infection? Before they're allowed to come in, students would be essentially required to do the same thing. So they would have to attest to their health on a daily environment. So those were all things that were going into the decision-making process to return our students. So thankfully, we've been granted the permission to have our students come back in a staged fashion. The fourth-year students that are closest to graduation will come back in the middle of June, and our third-year students will come back in the end of June, beginning of July.
Okay, thank you for that. So as everything in our lives are kind of moving towards these more virtual style things, like I know you mentioned undergraduates having to move to sort of like online classes, and I know our first and second years have done that. I'm wondering what UVA, like other med schools across the country, have done to adopt a sort of virtual curriculum.
Yeah, actually, I was a little envious of our undergraduate equivalents because they were out on spring break and they had more time to switch to a virtual environment. Our third-year students essentially on Sunday night, like the 16th of March, were told they weren't coming back to the clinical rotations. The fourth-year students were told 3 days later. By the following Monday, we had virtual classes and courses that students could get credit towards graduation up and running, which took not only the help of the actual course directors to design the courses, but we had to get special dispensations from our curriculum committee that we could allow students to take fourth-year credit before they were fourth years. We had to get the course reviewed by the curriculum committee, make sure that what were the learning objectives, what were the resources, what were the assessments going to be, because that's all very precisely controlled by our curriculum committee. So it really was a kind of heroic effort to get all that taken care of. And we converted pretty quickly to virtual courses.
Mm-hmm. And can you give an example of sort of the topics, general topics that are...
So we had several, I would kind of categorize them in different ways. We normally have several humanities courses that we offer in the fourth year. So we have courses that are in literature and medicine, law and medicine. One of our, or two of our, they're actually a married couple, Marcia Day Childress and her husband James, work in the Center for Health and Humanities and Ethics. And they actually had prior coursework from a pandemic course that they had run. So they actually reached out to us and said, hey, we've got a great idea. We have some of these resources already created. Can we do this? And we turned around and said, awesome, but can you do it for 2 classes, which means 300 students, which was a huge lift, but they came through and were able to do it. So in addition to that, as time grew on, we included other courses about patient quality and safety, high value care thoughts. we went to more clinical realms, things like radiology, dermatology, and we actually had a fabulous course that had about 60 different faculty involved in it, that really attacked the idea of COVID in our healthcare system now, and everything from the basic science and virology about that infection pandemic, to how do we deliver care? How has that changed? How have we gotten supplies? What are the, social science aspects of this? How are we trying to work on a vaccine, the testing? It was actually, I think, a really fabulous course and very timely for our students.
Right, I agree. I think that they did a great job turning things around so quickly. So the other thing that I'm thinking about is that during the pandemic, lots of businesses have been closing. And one of the businesses that have closed are the testing centers that medical students use to take their licensing exams. So I kind of want to hear a little bit more about this challenge. So kind of my first question there is, how have fourth years been impacted by the delays in administering what's known as the United States Medical Licensing Exam, also known as the USMLE exam?
Yeah. So as part of becoming a physician, you have to take several national licensing exams, and they are scheduled throughout the course of medical school as well as into residency. And two of those are, step one, which we do in the first 2 years of medical school, and then step two, which is divided into two parts, usually after the end of your third year. So our fourth year students generally by this point in the game have all taken their licensing exams, which are requirements for moving on to the next step in medical education, which is a residency program. And in their fourth year is when they apply to that. So mainly by now that has been completed. Unfortunately, at the exact same time that we were shutting down our clinical education, the national board was also cutting back on the centers that actually deliver these exams, because these are very well protected, highly confidential, high security exams that have to be administered in very controlled environments. And many of those centers just shut down. So for weeks to almost 2 months now, students have not been able to take these exams, which has caused, as one can imagine, a great deal of stress, because it has not allowed them to kind of continue filling out or meeting the requirements of the next steps of their education. And as those centers are just now starting to open, they're having to do so with a reduced number of students allowed in the centers. So even though they're opening kind of at half the numbers that they could get through. So students are really going to be delayed in this process. The good news is that on the other end, the residency aspect of this, many of the residency programs are being a little bit more lenient in their time frames for allowing students to complete this requirement.
So you touch on an interesting point about the test being, very confidential, highly regulated in how it's administered. And so there have been talks, I know some rumors about the test maybe being administered at medical schools around the country rather than these testing sites. Have you heard anything about UVA specifically? Are there any plans to administer any of these exams here?
So as soon as that question came up and that potential opportunity, we have several administrative staff and faculty that have connections to and work with different groups at the national board level. And we threw our name in the hat to be considered. Right now, what they are actually looking for are medical schools that are in larger populated areas that have some of these centers already located so that they can pair with them. So unfortunately, we don't meet that essential requirement, but it hasn't been for lack of interest on our part to reach out and offer that to our students here locally and in the area, because we do have other medical schools in Virginia.
Yeah. So I'm thinking about the newly graduated fourth year medical students. Mm-hmm. And so for those students, I know that a lot of the traditional ceremonies have been canceled. Mm-hmm. So their match day was canceled, at least the in-person celebrations, as well as their graduation. So first I want to have you explain to us what's match day, mm-hmm. why is it important? And what have we done for our students that have had match day and graduation canceled?
Yeah. So match is very unique to the medical education world, and I will tell you, it is challenging. Um, as part of the match process, what's matching is a student desire and a residency desire. And students in their fourth year essentially submit applications. They've met all these requirements, and they decide based upon the specialty that they want to go into, where across the country they would like to apply to a residency. So they make the application, the residency program themselves review all the applications, and they say, we want to interview these students. So then students get an interview offered, the students interview, and at the end of that process, the students say, these are the schools that I would like to continue my education at in a residency, and they rank them. And then the schools themselves say, well, these are the students that we would like to have, and they rank those. And then those two get matched, and hence the term match. And it is swayed to the students, like the student's preference is the higher ranking, if you will, in the process. But on this particular day, which is in March, usually the second week in, the students all across the country at noon get to open their envelope and find out where they're spending their next 3 to 4 to 5 to 7 years of education. So it's really the culmination of 4 years of a lot of hard work. And very interestingly, somebody else is telling you the next steps. But what was our graduation like?
Right.
And I think graduations across the country, I will say from elementary school to middle school, from middle school to high school, from high school to college to graduate schools, have really changed. And I feel bad for every student at every level who's had to make modifications this year. So what UVA as a whole did was they had a online celebration for about 35, 40 minutes where the president of our university had some words to share, and then each of the individual schools and graduate schools had their degrees conferred on the students. And then many of the individual schools held their own ceremonies afterward. And for UVA Medical School, what we did was we had a virtual experience where the students, instead of having them come up and be hooded, which is a very traditional thing for medical school, we had sent out stoles that were fashioned in the school colors, so orange and blue, and they had the School of Medicine emblem and the year on it to give them so that somebody at home could kind of virtually hood them with this. Their names were called out, and we were on a Zoom kind of call just like this, where all those names were shared. And we did all the same traditional things that we do, handed out awards to both faculty and to our students. And we did it that way. I think everyone's heart was in the right place. It did not feel the same as the traditional, very kind of monumental culmination of their education. But I think it was as good as we could have gotten considering the circumstances. So, but as far as where is education going, I mean, I think it's bright. I'm a glass half full kind of person, and I definitely want to say we've got a lot of smart, very dedicated young people who I think have been incredibly resilient and are hanging in there and are rededicating themselves to really wanting to be physicians, and whatever it takes to accomplish that is what they want to do. I will tell you that although I don't know everything that students have done, there's been an awful lot of volunteerism, that volunteer spirit from your classmates and others to get involved into the community and to give back and to help out in many different ways, I think has been alive and well. And students are really just so eager to get back in and learn and become the best doctors that they can be. And, you know, we get a million emails from our students along this process about when can we come back. So I am very enthusiastic and energized about who we have here, who will be the next group of physicians to come out and to be those heroes on the front line and taking care of me and my family and everyone else in this community. So I really have only positive things to say about our students.
That's very kind of you, Dr. Bray. And my last question is, are you optimistic about medical education returning to normal?
What's normal is what I'm going to say. Yes, I think there will definitely be a new normal. I think that we have found that we can do many things in different ways. And I'll just give an example of, we have really utilized telemedicine and communicating with patients to make medication adjustments and those kinds of things in ways that we never ever did in the past. So will there be new opportunities within our medical education? Will there be new ways of transmitting information, interacting with patients, learning? Absolutely. But we are really trying to get back to what we know, what our traditional ways of teaching medical students are, and to do it as soon as possible.
Thank you for all of that. Very informative, very helpful information, Dr. Bray. And we appreciate you sitting with us, talking to us about how the pandemic has affected medical education. So we appreciate your time. Thank you.
Absolutely. Thank you so much for having me. I appreciate it.